Hello.
Okay, great. Thank you very much, Pastor. Thank you very much, Wendy. We move on. This evening, the program will be hosted by a personality from Jamaica who has been making some rounds very recently. I had a brief chat with her. She is known by recently the Footprints of Hope series that was being conducted by Pastor Samuels. She has been hosting that activity and has really made some marks for herself. She is a final year student. She indicated that she is in her final semester, her final 3 months, in fact, of school at the UWI, and her area of focus is integrated marketing communication. Ladies and gentlemen, this evening we welcome Miss Sasha Hay to take charge of the rest of the activities. Thank you.
All right, there we go. Good evening, everybody. So sorry about that, but we understand how the technical world can be. We understand how the virtual space can be. However, it is indeed an absolute pleasure to be here with you this evening indeed. And so thank you, Brother Gavin, for your kind words of introduction. Hello to everybody who is joining online, but we do say specifically to President of the IADPA, IADPA, that is, so there we go. IADPA, that the whole thing is slipping me right now, but that is Pastor Saul Ortiz. Good evening. We do have director of the IADPA bookstores as well, Carla Spangler, regional manager for Barbados, Dominica, St. Lucia, and St. Vincent. Esther Isidore, national manager of Antigua and Barbuda, St. Kitts and Nevis, not to mention Montserrat. Desiree Doyle, national manager of St. Croix, St. Thomas, St. John, Tortula, Virginia Gorda, St. Martin, Anguilla, and St. Eustatius. I got it right, St. Eustatius, and Saba Phil Rogers, national manager of Trinidad and Tobago and Grenada. Margaret Chrysostom, national manager of Jamaica, Miss Debbie Douglas, and manager of Suriname and Guyana, Gavin Houston. Our specially invited guests, our doctors, and well, team members, good evening. And I have to say a splendid good evening to those of you who are joining me on Zoom this evening. Not to mention, we do have some viewers over there on YouTube. Good evening, everybody, wherever you are joining from. We are in for a treat this evening. And guess what? If you haven't as yet shared this Zoom link, now is your opportunity to do so, because we will be talking about some scrumptious health stuff this evening. And I'm sure all the women, not only women, but the men who are joining also need to know this information, because we have to be able to support each other. Good evening, everybody, wherever you are joining from. But before we delve into this program, let me just say, former First Lady of the United States of America, Michelle Obama, says, women in particular need to keep an eye out for their physical and mental health, because if we are scurrying to and fro from appointments and errands, then we forget to take care of ourselves. But we as women need, what did I say? We need to do better at putting ourselves at a higher rank on our to-do list. And so this evening, we are charging you to get your pens and papers out, get your ears ready to learn something so that we can put ourselves higher on the to-do list. Well, if you are just joining us, it is absolutely the Feeling Good seminar this evening, where we'll be talking about health issues that women face. And we have special guests to take us through the program. Remember, if the program doesn't give you enough information, or if you want to have this information readily on hand, then we are encouraging you to visit any one of the IADPA bookstores in your community, in your country near you, and just ask the person for the Feeling Good book, and they will tell you more. This evening, we have two special guests that will be presenting to us on menstruation, menopause, breast cancer, and then the other one will be presenting on the mental state, or how these issues can affect our mental and social or emotional health. And I speak none other than for our first presenter. Her name is Dr. Sasha Durga-Lyons. Dr. Sasha is a specialist obstetrician and gynecologist for more than 12 years. She currently works at a few facilities, a few places, Port of Spain Hospital, the Good Health Medical Center, and the SDA Community Hospital in her country, which I didn't state, which is Trinidad and Tobago. So if we have any Trini in the house this evening, we're asking you just to identify yourself by posting your flags in the chat. Dr. Sasha is also a member of the Royal College of Obstetrician Gynecologists in UK from 2017. She is passionate about positively contributing to women's health. She also went to my school, where she completed her doctorate in medicine of OBGYN at the UE. And so Dr. Sasha will be presenting to us this evening, who is a proud wife and a beautiful mother, about menopause, menstruation, and breast cancer. Before I turn over to Dr. Sasha, though, I invite you, as I said earlier, get your pens and your papers, because at the end of this segment, or not this segment, but the seminar, we will be having some prizes and giveaways. You want to know what you're going to win? Sure. For each country, you will get one consultation free of cost, or the book that I mentioned. So you will have that information permanently wherever you are. And also, at the end of both presentations, we'll be having a session of questions and answers, where you'll be given the privilege to feed or to ask your questions to our presenters, and they'll be more than willing to answer in the best way possible. Remember, it is the Feeling Good seminar. We are about to feel good this evening. And if you're not feeling good now, after the presentations are completed and you know what to do, you will know what it means to feel good. And so right now, without further ado, we turn over to Dr. Sasha Durga-Lyons.
Hi, good night, everyone. Thank you very much for allowing me to come into your homes tonight. Just to give me 1 second for me to be able to share my screen. Excellent. Is that coming up well? Is everybody hearing me well? Yep. All right, good. So I tried my best to put together and cover as much topics as I possibly can within a short period of time. So forgive me if it's not in much detail, right? But that's the point of the questions and answer segment. I'll try to cover as much as I can. So the topic I chose to talk about today in this Feeling Good seminar is aging well. So to start, I actually have no financial disclosures. And of course, I must start with the definition. So what we mean by menopause is simply the last period. That's it. Now, it's kind of hard to tell realistically if that period that you're having now is going to be your last period. That's hard. So it's actually a retrospective diagnosis. You only know it's your last period after about a year has actually passed, and that average age is about 51. But the reality is that it doesn't just stop. They tend to become less frequent, and it can actually take several years for a woman to go through that menopause completely. Half of women actually have some symptoms of this phase, which is perimenopause, for almost 7 years at a time. The exception is what we call surgical menopause. So that's when you have a hysterectomy and you actually need to remove your ovaries. And when you remove your ovaries, you get that sudden abrupt change. So it's not a transition. So unfortunately, in those cases, it is very, very abrupt, right? And of course, the big question is, why does this happen in the first place? It's always because of this one nice chemical, estrogen. That's it, one hormone, estrogen alone. And I know this is a very busy slide. It's not meant for you to learn the embryology. Essentially, all it just says is when you are developing, when you are born with all the eggs that you will ever need in your lifetime. And when you begin to mature, so around your teenage years, your adolescence, essentially, your ovaries start every month, a few of these eggs start to develop at a time. So they slowly start to develop. And during that maturation, that's when you start getting these hormones being produced, and they cycle throughout your reproductive years. Now, your ovaries do not just function in isolation. They do get signals from other parts of your body, the higher centers, the brain. And then, of course, there is this whole feedback mechanism. So then the uterus and the ovary itself then tells your brain, hey, yeah, we're doing good, we're doing fine, everything is okay, things are great, continue as usual. So it's a cycle, it works well, right? Now, natural menopause, again, occurs when, as you age, your ovaries essentially stop producing the eggs. So then they start to make less estrogen. And in your normal reproductive life, you know, your estrogen levels are high. And then as you age, it goes down. It does not go to zero, by the way. You have, you know, other organs that could produce very little amounts of other types. So it's not zero, but it decreases significantly, right? And it is that limited secretion of estrogen that's entirely responsible for all the symptoms you're going to get. And a lot of women do not talk about menopause. It's a very taboo subject, but the reality is that women are living longer. We are thriving. And half of our lives on average now you spend after menopause, and that's significant, right? Now, 8 out of 10 women on average will develop these menopausal symptoms. And sadly, about a quarter of women will actually have very severe, sometimes debilitating symptoms, right? And most persons will know about this one, the hot flashes. In medicine, we call it the vasomotor symptoms. That's when all of a sudden you feel this hot gush of like heat and your face gets flushed. Some women actually feel chilled after, some may feel to faint, some persons feel weak, some get their heart racing. It's a lot. And sometimes it's associated with so much sweating that it can actually disturb your sleep. You can soak your bed sheets, right? So it can, you know, affect your way of life and your comfort significantly. Another common one that a lot of people don't realize happens very often in menopause is bone pain. So as you become older, your bones actually become less dense itself, and you could lose bone mass. Now, over your years, as you're growing, you do slowly develop a lot more bone mass, and that we call a bone density. That peak is somewhere around 30. So in your adolescence, you still don't have a lot of bone mass, but then you gain it, and then after, bam, menopause hits, and then you slowly start to thin out. So osteoporosis is when you have significant bone loss. And with osteoporosis, women can actually get fractures very, very easily. They fall, and it happens a lot at Christmas time. So, you're cleaning the house and you don't even realize a simple fall or a simple hit. And just like that, you get a fracture. So it happens commonly, again, after menopause when the estrogen levels fall, because estrogen does have an impact on your bone growth. Your skin and hair, now a lot of women will tell you, if you pay attention to yourself as you grow, your skin and your hair changes as you grow. So the teenagers, of course, the lovely thing, acne, right? You breathe and you think you get, acne and oily skin. That's because of the estrogen. So it actually helps your skin get thicker and oilier. And then as you get into menopause, you actually lose some protein in your skin, the collagen. It makes your skin thinner, drier, and more likely to itch. Dry skin itches. 1 second. Right. And this is something we have to talk about because a lot of people do not talk about it. Women, we need to pay attention to ourselves and start becoming a little more open. The vagina and the vulva, which is the skin and the top of the vagina just around, is skin too. It itches, and then when it becomes thin and friable, it expands less easily. There is less lubrication. Sex becomes painful. The vulva itself, that area around your vagina, actually itches. On top of that, you can get urinary problems. So you would realize your grannies always have pads in their house. It's not because they're having a period, it's because they tend to urinate themselves when they go out and they don't say anything about it. They put on a pad, and if they cough or sneeze or they go out in public and they can't reach their bathroom in time, they can wet themselves. They could have recurrent urinary tract infections. And then, in Trinidad, you always hear about this term that the bladder or the womb drops. It's essentially that muscle, that entire layer in your pelvis just gets very weak, again, from the estrogen. So all the muscles holding your pelvic organs get very weak, and they actually prolapse a bit, right? And this is something, again, a lot of people forget about, the heart health. Now, estrogen actually protects our heart and our cardiovascular system, right? On average, cardiovascular disease will actually develop like about 7 to 10 years later in women than in men. But after the age of 65, it actually becomes the leading cause of death in women. But just by the way, this is changing. Poor health, poor diet, sedentary lifestyle, that number is dropping, and more we find that younger women are succumbing to cardiovascular disease. But as a general thing, estrogen is actually thought to protect your blood vessels. So we do have a little bit of a protective effect still over men in the premenopause state. And again, a lot of women sometimes don't understand these symptoms. They don't understand why they're tired all the time and why they're irritable. They have difficulty sleeping. They have anxiety and depression. And if it was pre-existing, sometimes it gets worse. The loss of the sex drive is not entirely just due to painful sex. It's just you don't feel like it. And then sometimes you don't feel as if you're coping very well at all. Headaches can actually get worse. And in some women who have migraines because of the fluctuations in estrogen, some women say around that time of menopause, the migraines get worse. You can sometimes hear the same complaint in teenagers when they are now starting to have their periods, and it's sort of as if their estrogen levels are still fluctuating. They're getting used to having these regular cycles. Some of them will complain because of a very, very similar etiology. Depression is common, a lot more common than we think. And I know our following speaker will talk a little bit more about this, but it is thought that estrogen kind of helps secrete serotonin. That's that happy chemical that boosts our mood, right? And when it drops, the estrogen levels drop, it contributes to those mood swings and depression. Dementia is also a real thing, and that's when you have problems concentrating and with your memory. And again, it has to do with estrogen helping to communicate helping these other chemicals communicate in the brain cells, and that's important for memory. But this is the most important thing, treatment. So it's not that you have A, B, C, and D and choose one. No, that's not how it is, and that should never be how it is. We can combine all our treatment options to actually choose the best one for the individual patient that's in front of us. So the first thing we like to talk about is lifestyle modification. So you know you're sweating in the night, wear lighter clothing, sleep in a cooler room, avoid a lot of caffeine, smoking, alcohol, spicy foods. At the end of the day, stopping smoking has a lot of other health benefits in the first place, right? The caffeine intake, especially at night, will actually help with persons who get up frequently to use the bathroom, right? So we start with those little things. And of course, exercise. Now, exercise that tends to be aerobic. So it's sustained kind of regular something like running or swimming or yoga that contributes to reducing stress, weight loss, and it actually helps, especially with those vasovagal symptoms that we talked about before. Now, mind you, I'm not saying that weight training and so on is bad. If you are accustomed to doing that, that's fine. It's just those strenuous bouts of exercise could sometimes just make those hot flashes worse. The good thing about doing weight training is that it actually helps with your bone density, and you don't have to wait for menopause to start weight training. They could actually start that very, very early on, and that makes a significant difference in the long term. Pelvic floor exercises. Now, honestly, and even though I tend not to endorse stuff, I really, really liked how the book talked about Kegel exercises. So there's this entire page that they described the Kegel exercises beautifully. So it's where you actually exercise your pelvic floor. We do this, we actually regularly ask women after they give birth to start doing this. And in menopause, this actually helps with your urinary discomfort, that feeling of pressure coming down, and it helps with sex. So the book describes it great. It has a whole chapter actually on genitourinary problems. So it describes everything for you there. Now, I'm going on before, I do have to talk about hormonal replacement therapy, but I will start with the other things before I get to that point. There are other things besides giving hormones. So there are other drugs, usually clonidine, gabapentin, some other stuff. If a patient is not suitable for hormonal replacement, and I will get into that, there are other options. And if a person's primary complaint is not the vasovagal symptoms, so it could be just the depression or the problem sleeping, or sometimes it's the pain, then we can actually choose this, a different way of treating everything. And in comparison to what we call placebo trials, some of these actually do reduce the vasomotor symptoms as well as help with the mood changes that occur. Vaginal moisturizers. Now I have this picture of this particular brand. So in the UK, Replens is actually considered a lot better than just the simple KY jellies. And so because it's a vaginal moisturizer, it actually stays in the vagina a bit longer. So it creates a nice moist environment for sexual activity. And I talk very freely about it. I hear a lot of women say, oh no, sex is for young people. Oh no, never, right? If you are feeling good and you are up to it, you can enjoy sex at a ripe old age. That's fine. It is perfectly fine. And then actually having regular sexual intercourse increases the blood flow and actually helps with the symptoms a little bit better. In Trinidad, this Replens is actually a little bit hard to get. There are other substitutes out there, but you know, it depends on where you are, right? I'm sure our next speaker will actually talk about cognitive behavioral therapy, so I will skip this for now. And of course, there are complementary therapies: acupuncture, reflexology, magnetic therapy. From a medical point of view, here's my stance on it, right? You have very small studies. You have to be careful about, you know, interpreting or just looking at somebody that randomly does a study and say, hey, I think this works, yay. You know, let's try this. This is better than medication. You have to be very careful about that. Some small, tiny studies may say that. But here's the thing. So if you put on a magnetic slipper or those back massages things, sorry, I don't know the names of them very well. The reality is that there is no harm in doing it. It may not do any good either, and you may actually kind of spend some money, but if it's not going to do any harm and if it makes you feel better, my take on it is you can do it. You can go right ahead, have your massages, have your reflexologies, that's just these pressure points massages as well. You can do it, it's entirely up to you. And now this is what I want to talk about a little bit more, is hormonal replacement therapy. Because the reality is that for some women, the symptoms are not mild, and it is distressing and debilitating. And the theory behind it makes sense. So if the etiology is estrogen deficiency, then it makes sense to just simply replace the hormones. The treatment should be targeted to the woman's individual needs. And that's really, really important. And the woman needs to be involved with the practitioners to say, this is my primary complaint. This is what I need help with, right? And then we choose the most effective agents then for that patient that is in front of us. The decision depends again on the individual. We do look at your quality of life, how old you are, how much years since you've had your menopause, and of course, any health issues. We can't just give you, estrogen or medication just like that without a clear indication. The duration has to be consistent with the treatment goals. It is safest to use, honestly, for about 5 years and around 5 years from your menopause. We can't go longer than that, honestly. We tend to use, again, the lowest dose. And after 60, we reevaluate. It does not mean we have to stop. We reevaluate. But of course, you have to know yourself as a woman. And again, the Truth is a Book does have a lovely chapter on this. So women need to know, I do need to do my yearly mammograms. I do need to do my cervical smears. I do need to get checked. You do need to have these things, in order. And then you can do this on a yearly basis, a checkup or so. The choice, again, is dictated by the clinical situation. We will change medication if we don't have proper symptom control. There are side effects. There are times you will get nauseous. And of course, nothing is without risk. So there is a risk of stroke. There is a risk of blood clots, right? There is a risk of cancers, but we will talk about that shortly, right? Now, these slides are actually from a UK website, and I could not summarize it any better. Their slides are beautiful. So when you have those vasovagal symptoms, it is very good, high quality evidence. It's more than 80% better after about 1 month of use. Those symptoms get significantly better. If the issue is more the vagina area, simple topical estrogen creams work well for the vaginal dryness and the urinary issues, right? For the overactive bladder and for persons who are having recurrent infections, right? There are times when persons who, I have to rephrase that. So there are times when persons have, they urinate on themselves if they cough or sneeze. We don't primarily give hormonal replacement specifically for that, but we find when we do give it that there is benefit. It's the same with dementia. We do not treat dementia with hormonal replacement therapy, but again, we find that persons who are on hormonal replacement do have a lower chance of dementia. They get dementia at a later age and so on, right? So when we definitely do not is when there is a history of breast cancer, you have had a stroke, or you have had blood clots. The blood clots, sometimes we can use the patches, but this is when we do not use hormonal replacement therapy at all, right? And again, it's based on the individual that's in front of you. And of course, there's alternatives, and we know about that. A lot of women, because of all the media hype. So there was this huge study published, they call the Women's Health Initiative and the Women's Health Study, and the media had a field day, essentially. And you know, the media can misinterpret things a lot, and all the media put out there is that hormonal replacement therapy equals stroke, equals breast cancer, which is, unfortunately, it's not true at all. But they put that out there, and if you actually just Google anything, you're gonna find that that's the first thing you're gonna see. But that's not true. So a lot of women tend to, because of that, go towards the alternative therapies. The reality is that these herbal therapies are thought to be what we call bioidentical. So they have a similar chemical component to the estrogens, but we do not know. It's not clear how safe they are. It's not exactly clear how effective they are. And then some therapies can actually interact with other medications, so we have to be careful. Now, the THR I see this is, again, I'm not sure if this is in the Caribbean, but it's a traditional, there's a regulatory body, a traditional herbal registration, and they've been trying to actually regularize the industry to some extent. We know for menopausal symptoms, black cohosh, red clover, evening primrose, and sometimes St. John's wort, you find that a lot on the market. There is evidence, honestly, for isoflavones and black cohosh. It may improve some of these symptoms, but again, everybody has their own preparations, and some of these products can interfere with medications, for instance, your blood pressure medications. St. John's wort, some women actually say it does improve their symptoms. Again, it doesn't seem to make any difference with respect to, the mood changes, but we don't know, again, the long-lasting effects, and there is definite interference with medications like tamoxifen. So persons take tamoxifen if they've had a history of breast cancer, even if they are in remission. There are some women who are still on tamoxifen. These phytoestrogens, so some of these compounds, again, it's very similar to estrogen. So we think it acts by, binding to the same cells in your body to kind of give a similar effect. And we find that certain foods, such as soya, flaxseed, the red clover, they just have the richest sources of those phytoestrogens. There is some data that Japanese American women, tend to have lower rates of the menopausal symptoms, and they were thinking it's because they have a lot of soya in their diet. Not sure. we need better studies overall in medicine overall to actually confirm these things. All right. Again, a lot of cereals, seeds, beans, vegetables, a lot of these will have phytoestrogens as well. At the end of the day, right, in summary, only a woman can actually define the benchmark for what she wants as to be her quality of life. The woman will tell you, I can tolerate this, I cannot tolerate this, I need help. And it is important for women to be aware of the changes that are happening to their bodies and when to seek help. Simple things like the vaginal itching. We know that vaginal itching is not entirely due to menopausal symptoms. There are times when it can be infection. There are times when it can be precancerous lesions on top of that. So if it persists, you know your body, seek help. Now, the cornerstone of any medical opinion is actually looking at medical literature and explaining our existing evidence. And the reality is that there is not enough high class, what we call level A evidence, right, for managing menopause with women who have a lot of comorbidities. And the reality is that we will probably not have that in the future either. The important thing is if from an early age, we manage these comorbidities, again, prevention is better than cure, weight loss, cessation of smoking, cutting back on your alcohol intake, right? Looking at all of that, if we actually do that from an early age, then when you reach that golden age of menopause, then the transition is going to be so much easier. Again, I always preach a combination of the lifestyle modifications, alternatives to just pharmacological agents. And again, lifestyle modifications are beneficial at any age, any long term. So I do have a lot of references, and half of them were put on the slides as we were talking. And again, thank you for inviting me. And that's the end of my presentation. So I am free to take questions if that is allowed at this stage, or if you all are waiting till later.
Thank you so much, Dr. Sasha. I mean, Sasha is so easy to say because that's my name. So excellent presentation indeed, Betty, we do agree. Excellent pointers there. I mean, a lot of things are going on in my head as it relates to estrogen, because that word, that hormone, I don't know, man, but a lot of stuff. But we thank you so much. We will actually be taking some questions, but not at this moment. We will take the questions after Dr. Alfonso has presented. And so we will just move. So guys, if you are joining, I'm seeing the numbers going up. We are now at 708 viewers on Zoom, and on YouTube, we are almost at 200. I'm not sure if it has gone more as yet, but if you're just joining us, we welcome you to the Feeling Good seminar, where we are having this informative, exciting, I mean, even if it's taboo, the conversation is happening right here for the IADPA bookstore, the IADPA. On behalf of the IADPA bookstore, we are having the conversations. Please ensure that you are writing down your questions, you are making note of your questions, because we will be taking them after Dr. Alfonso, which is the next presentation. And so without any further ado, let me just take this time to introduce Dr. Alfonso Jerry Simon from Antigua and Barbuda. He has been a medical doctor for more than 20 years. He is a clinical physician at the University Park Health Center. He's an adjunct professor at the American University Antigua and the University of Health and Science in Antigua. He has been director of medicine and wellness at NSA Medical Center. He is certified by the International Society of Addiction Medicine in diagnosis and treatment of addictive disorders for the past 7 years. Dr. Alfonso has served as a medical officer at Antigua's main hospital and psychiatric hospital. He has served as a medical doctor for Crossroads Substance Abuse Rehabilitation Center. And I'm sure he has a lot more accolades to his name. But let me take this opportunity to welcome Dr. Alfonso Jerry Simon, who will be presenting to us this evening about the mind, the mental state of our lives, our mental and emotional health, and how menopause or menstruation or aging can affect our mental well-being. Over to you, Dr. Alfonso. Welcome and thank you for joining.
Good evening, one and all. And I hope I'm being heard. If I'm being heard, someone can just raise their hand so I know that. Physically raise your hand. Very good. I'm seeing that. Thanks very much. So I just want to say first and foremost, thanks very much for those who put this program together, for inviting me to present. I'm always interested in, sharing knowledge. And I believe that knowledge, when mixed with wisdom, give us power. And of course, we know wisdom ultimately comes from God, and knowledge as well. First and foremost, I just want to pick up on something that Dr. Sasha mentioned, and she mentioned about cognitive behavioral therapy, or CBT. And I just want to touch on that a little bit to start. And the reason why I'm going to touch on that, because everything starts in the mind. And as the Bible tells us, as a man, or in this case, a woman, thinketh in her heart, so is he, or so is she. And I want us to really bear this in mind when we look at some of the health issues that affect women, especially mental health issues. A lot of things that the mental health issues that affect us are created in our minds, or start from the way that we are trained, the way we think. And if we can change our thinking, then we can change our actions or change our decisions. And if we can change our decisions, then we can change our actions and we can change our results. So it's very important to understand that it starts in the mind, how you think, the decisions you make from your thoughts. So it's important to be feeding yourself with good, knowledge, or feeding yourself with good thoughts, so that your decisions and actions can follow suit. So just to come back on the CBT issue, one of the things that I've noticed in my practice, and I mainly practice as a general physician, although I deal with mental health issues and addictions, I do notice that there are a lot of women who come with dysmenorrhea, or what we call, painful menstruation and things like that. Now, painful menstruation is real, and I'm sure the women here who are listening can attest to that. But quite often, one of the problems we have with painful menstruation or dysmenorrhea is what happens when a girl has her first period, or even before that. That sometimes in the whole psyche and the whole development of that young lady, there are times when our mothers can be a little bit overconscientious, if you want to put it that way, and kind of psych a young lady into thinking her periods are going to be painful all the time, or it's going to be that way every month for the rest of your life, or until you don't have a period anymore. And so again, it goes back to mindset. We find, for example, in Western countries, in the United States and Western Europe, for example, especially in the United States, that you have higher rates of dysmenorrhea compared to, let's say, places like China and Japan and Asian countries, and even African countries. So a lot of it has to do with the mindset. So it's a real issue, but remember that the mindset around it has a lot to do with it. And for example, we see in Africa and some Asian countries where there's a rite of passage, both for men and women, where you find that, as it were, the village or the community raises the child. And you find when a woman goes from, let's say, girlhood to womanhood, there are certain steps that they go through. We might think some of these things are spiritualism, and some of them might not necessarily be something that we would practice. But the whole idea of having that rite of passage is very important, because it's a way to teach a woman, or to teach a girl how to be a woman, and to teach a boy how to be a man. It's not something that we practice often around here. So we find that both women and men have a very warped way of thinking quite often in terms of gender roles. And especially in our modern societies now where, some people think that we are post-gender roles as opposed to the biblical, way of women and men. Some of these things create problems. And I don't want to ever think at all that anyone want to think that I'm thinking or I'm saying that men are not equal to women, because they are. Adam and Eve were created as equals, one by the side of the other. However, they do have different roles, and the mindset, the brain, the way a woman naturally thinks is different to some extent from the way a man thinks. And that is what helps to prepare us for these roles that we have in life. So it's very important for us to, for example, a man is naturally created to be a protector and a sustainer, so to speak, for his family. A woman is more of a nurturer to her family. And this is something that is created innately in us. So I don't want us to ever try to get away from those gender roles that we have, because they can create serious problems, in our thinking, in our decisions, and in our actions. Another thing I want to touch on is the attitude towards sex. And Dr. Sasha mentioned that in her discourse. Quite often we have this kind of taboo when it comes to sex. And if there's married people listening, I want you all to listen carefully and listen well. There's nothing wrong with sex. However, it has to be done in the right way, in the sense that both partners are on board with what they're doing and are expressive and can express what is it they want, what is it they need from sexual activity. Because quite often, sometimes you go to marriage seminars and you go, especially in our churches, you hear the pastors talk and act as if sex is something bad or men love too much sex. And I keep telling people, the only organ in the human body, and Dr. Sasha can attest to that, the only organ in the human body, male or female, that is purely created just for sexual pleasure is a clitoris in women. In the man, there's no organ in the man's body that's purely for sex. In the woman's body, the clitoris is created purely for sex. So this myth about sex, we need to get that in the open, talk about it so people can enjoy sex in a happy, healthy marriage relationship and not, be afraid to talk about it, be afraid to do it and think that, everything is weird and bad about it. Now, quite often, women have issues that, not only affect their sexuality, because sometimes we think of the women issues as just reproductive issues or the gynecology issues. For example, we talk about menstruation and the dysfunctions of menstruation. We talk about breast cancer, for example, cancer of the cervix, menopause, things like that. But remember, there are other issues that women face as well. For example, more women are predisposed to getting something called lupus, which is an autoimmune illness, a debilitating, lifelong autoimmune illness without any cure. And as a result of those illnesses, or even cancer, not necessarily just breast cancer, but other forms of cancer as well that affect women, it's very important for us to recognize that women also need the emotional support going through these illnesses. So I just want to touch briefly on the women issues, though, the ones that we consider to be women's issues, cancer, menopause, and dysmenorrhea and these kind of things. Now, when a woman has, for example, breast cancer, that is something that not only affects her health from a general point of view, but affects her health in a way that makes her a woman. So breast cancer, the breast is something that women have and something that men don't, at least not the type of breast that women has. So it's something that is, when a woman has breast cancer now, it's not only, oh, I'm dying of cancer, or this cancer potentially could kill me, but the cycle of it as well too. Let's say this woman is in a healthy sexual relationship with a partner, then that is another layer of affectation that affects that woman. So it means then that we have to make sure that that emotional support is provided. That's the importance of having these support groups, whether it be support groups of breast cancer patients. In my practice, we have support groups for breast cancer patients, cancer survivors, people with cancer of the cervix, people going through menopause, well, menopause in the sense of, post-menopause, dementia, these kind of things. So it's very important to have that emotional support when a woman is going through, whether it be cancer of the cervix or breast cancer. Now, it was mentioned earlier that I deal with addiction, and I want us to, for those who already bought the book, and I hope that if you haven't bought that book as yet, you go and get that book purchased, and whichever country you buy that book, tell them Dr. Simon tell you to buy the book, so give you a discount. Now, I want us to recognize that addiction is a woman's problem as well. And when I worked at Crossroads Center in Antigua, I worked there for almost 10 years, was the medical director for 9 of those years. And what we found that we had a lot of men in the early days who were coming in for addiction treatment. We had men from all over the world, from the 4 corners of the world. And I was wondering if women don't get addiction problems. Starting doing the research, we realized that women do have quite a lot of addictions, but quite often it's not easy for them to talk about it, especially the way that society looks on women's issues, especially in terms of addiction. So you find that a woman drinks a lot of alcohol, but she might drink it at home as opposed to a man who goes to a bar and get drunk. Women takes a lot of pills, pills for sleeping, pills for anxiety. Sometimes they overdose on these pills. Sometimes they're addicted to these pills, going through their stressful issues, but they don't necessarily talk about it as much. So what we found over the years, after I've gone through 5, 6, 7 years at Crossroads Center, I found that more women were coming in to get treatment. In fact, what we find now, and this book also mentions it, that more women now are picking up smoking as opposed to men. The rate of smoking in men is actually decreasing generally worldwide. In some countries, it's still increasing, but in most places, it's actually decreasing on a general level. But in women, it's actually increasing on a general level. So it's very important, again, to recognize that addiction is a part of a woman's problem. Women can not only be addicted to drugs, that was my main treatment area, drug addiction or substance use disorders, but we also find internet addiction. Nowadays with Facebook and Twitter and Instagram and all these, so-called technological advances. A woman can be addicted to gambling, just like a man can. They can be addicted to sex as well, and many other addictions out there that women are suffer from or can participate in. So it's very important to us to recognize that addiction is also a woman's problem. Now, mental health is not something you can just think your way out of. And although I started by talking about CBT, cognitive behavioral therapy, change your mind, change your thinking, change your attitude, change your decisions, change your actions, and change your outcome. And that is true. But notice that I mentioned change your actions and change your outcome. Because quite often when people get depressed, they want to think their way out of depression or think their way out of anxiety. And yes, it starts with thinking, but it also has to do with actions. So I want to just go back a little bit to talk about some of the actions that we can use, women especially can use, in order to preserve their mental health. And I firmly believe that most mental health illnesses are preventable. So the first thing is movement. Our body was made naturally to move. We are taller than we are wide. Even if you're overweight, or you're a short person, your distance between your head and your toes is greater than the distance between your left hand and your right hand when you stand straight at attention. It means then that our bodies are made to move. So it's very important to find whatever activity you love, whether it be hiking, dancing, swimming, aerobics, exercising, gymnastics, whatever it is that you love, cricket, football, find a sport, get an action and do it. We find a lot of women tend to do maybe more formal exercises. They join exercise groups, which are good because they need that kind of support. They join gyms, as opposed to men who might play a sport and stuff like that. But it's important as well that women get out and do something they love. Because sometimes you go to the gym, it comes a talk shop after a while. You're breathing in the circulated air that's going around, the carbon dioxide coming out of the AC system. And in the days of COVID now, I'm sure those who go to a gym sometimes they're wearing a mask, so it's not a happy atmosphere like it maybe used to be. So it's very important to find some activity that you love and do it. Most of our Caribbean islands and in Latin America as well, we have great outdoor spaces, hiking trails, mountains, rivers, the beaches. So these are things that you can utilize. Breathing exercises, and the book speaks about that as well, I think in chapter 1. Breathe. Take the time to have proper exchange of carbon dioxide and oxygen. It gets that fresh oxygen going to your brain. It gets the glucose going to your brain, and then your brain can utilize the energy that's being produced in your body in a more efficient way. Wake up in the morning early before the day gets, all discombobulated and hectic and active. Get outside in the fresh air, especially if you live in the country area. So for the town folks, I feel a bit sorry for y'all. But most countries, if it's early in the morning, the air is probably still good quality in the town. You take some deep breaths, maybe 10 nice, very deep breaths to get that good exchange of oxygen and carbon dioxide. When you do that, you're taking that bad energy out your system and a good energy in. The next thing is to have a purpose-driven life. It's important to have a purpose. Women sometimes lose a sense of purpose because their life tends to be wrapped around their families, husbands, jobs, chores, and all that kind of thing. And I keep saying, if you can't nurture yourself, you cannot nurture anyone. If you can't take care of yourself, you cannot take care of anyone. Why? Because at some point you're going to get burnt up. At some point you're going to resent the things you do. So it's very important to find your space, to find your time, to find the things that make you happy. It might be painting, like I mentioned earlier, singing, dancing, writing books, writing poems, writing stories, whatever it is, your girl group, whatever it is that makes you happy, that can nurture you, your favorite TV program, whatever it is that nurtures you, find the time to nurture yourself. Another thing, do not ignore personal devotion. Don't ignore your personal time with God. Quite often we get busy, and in our busyness, especially women, again, they're always busy. I always say that when a woman's on vacation, it's not necessarily vacation, it's usually a time to spring clean, even if it might be summer or spring or fall. They'll have the time to clean the whole house and to do things and do that. It's important to take the time to not ignore your personal devotion time with God. Also, you need to downshift. And notice a lot of things I'm saying is getting away from certain activities. Downshifting simply means changing your activity, doing something different, finding a time to rejuvenate yourself by finding an activity that you love, that you enjoy, that you want to do with, friends, like-minded people that can nurture you. Fellowship. Women tend to do this better than men. Women tend to some extent. And when I say fellowship, I'm talking about church fellowship here. That's very important. And don't be too busy not to have church fellowship or even family devotion. These are things that help to connect families and help to give women also a sense of well-being as their family grow together and connected. Circle of friends. Men tend to go outdoors and have outdoor activities. It might be the domino group. It might be the basketball Sunday morning group, the football Thursday afternoon group. It's also important for women to have these groups as well. Their circle of friends. Especially as the children grow, they're okay. Women have to allow children to be themselves. Children are not helpless human beings as we think, okay? They can manage for themselves. If we train them early to do things for themselves, they can. So we need to do that from an early age so that the women now can have their time to have their groups with their friends so they can rejuvenate their energies. Very important. Rest, sleep. We all need rest, sleep, whether you're woman, man, child, boy, girl. Rest and sleeping is important. Your afternoon siesta, if you can, or make sure you get in, 6, 7, 8 hours at night. Now, I must have a disclaimer here. We often say get 8 hours sleep, just like we often say drink 8 glasses of water. But I do know every person is not the same. Every person don't have the same occupation. Every person don't have the same metabolic rate, metabolism. Everyone does not necessarily need the same amount of sleep. as others. But make sure that when you wake up in the morning, you're well rested. If you wake up in the morning and feel tired, it means you haven't got enough restful sleep. So that can be a rule of thumb. So if you're sleeping only 4 hours, but you wake up in the morning feeling tired, please get some more sleep. Now, it's important as well to heal and forgive. And this is important because sometimes we tend not to forget what has been done to us, good or bad. It's important to not only forgive, but it's also important to heal from whatever has been done unto us. And, sometimes women, even amongst other women, they have these kind of little grudges and things like that because of something that would have happened sometimes so long ago. It's important for us to heal and forgive. Take that blackness out of your heart. Believe it or not, as the Bible talks a lot about the heart, and as a person who deals a lot with mental health issues, I do realize that heart disease tends to be more prevalent in people who, I should use the word, people who are miserable, or people who just always have this kind of mean demeanor. What it does, it generally causes the blood flow in your system to be less efficient. And as that blood flow becomes less efficient, the heart does indeed suffer. So it's very important, again, how you think, decisions made, actions taken. When we think healthy, we are healthy. And that's why sometimes when patients come to me, I don't discuss, quote unquote, the disease that they come to me about. I discuss how do we get better or how do we stay healthy. So they might come and say, oh, Dr. Simon, I have this, I have that. And what can I do to get better from this or that? I say, it's not getting better from your urinary tract infection. It's not getting better from your COVID issues. It's not necessarily getting better from your lung disease. It's getting better overall. It's staying healthy. Because quite often, many of the things we do to help one disease quite often helps another. So you are what you eat. If you eat a lot of meat, and meat is something that's dead from an animal that have certain hormones in it, certain chemicals in it that makes it fierce and ferocious and angry. You find that when you eat a lot of these meats, especially if they're produced in certain ways, like in their factory kind of production, most animals are not produced free range nowadays or farming. They're in these kind of factory settings that they release certain chemicals and certain hormones. They do become a part of your body. So we find that to help your mental health, if you eat more fruits, vegetables, greens, eat with your families, it's very important to eat with your family at least once per day, or do something with your family at least once per day, so you can interact with your family as you eat, you talk, you share. In my family, my extended family, that is, we often meet Sabbath afternoons, and I'm glad that hopefully the COVID might be winding down soon so we can get back to doing that again. But the extended family meets on a Sabbath afternoon, and we sing, we talk, the children, they talk, they interact, we have fun, we sing the hymns. And that is a way of keeping families together, number one, but also a way of, rejuvenating the spirits for the next week. So, I know my time is coming to an end soon because I was told 20 minutes. So I just want to just recap a little bit. And like I said, the book has some very good chapters. It's a very simple book. That's why I love it. It's simple. The layman can understand. They use medical terms, yes, but the medical terminology is explained very well. Although I think a little bit could be done on mental health. So maybe look out for my book sometime soon or sometime in the future, so I can add to some of the things, the knowledge that we need to have in the Caribbean region in terms of our health. So I just want to say, let us, as men and indeed women who are listening here, think about your health. It's not selfish to put yourself first in a sense. And I'm not saying that, everything is about you as a person, but it's very important to recognize if you don't take care of your health, guarding your mental health, guarding your spiritual health, guarding your emotional health, guarding your social health, then you won't have what it takes to give to those who are around you, your families, your husbands, your children, your community. So when you guard your personal health, then you're able now to give and deliver the way that you want to. So with those words, I just want to say thanks very much for listening, and any questions I'm sure will come afterwards as the time permits. Thanks very much.
Well, there we have it, another very informative presentation. Thank you so much, Dr. Alfonso, for your insights, for your knowledge, and for sharing with us this evening. Let me tell you, I got a lot of nuggets, as well as I have a lot of questions. But if you are listening and you were listening, let me just tell you this. No, what I took away from both presentations is that health is holistic, especially based on what Dr. Alfonso just presented. It's not just the physical, it's the mental, it's the spiritual, it's the emotional. And so we have to find that balance. And remember, you cannot pour from an empty cup. And so as I started earlier this evening, I reminded us what Michelle Obama said, that we as women, we scurry, we hustle, we bustle, and we forget to take care of ourselves. And so I'm encouraging you this evening, if you are here, you're a woman, take care of yourself. If you are here and you're a man, help that woman take care of herself. I mean, awesome presentations for tonight, guys. Now, we'll be going straight into the, Judith, no, open the door. Now we'll be I'm so sorry about that. Now we will be going straight into our question and answer segment. We do have a lot of questions here, and I am expecting to get some great responses. Now we'll be starting off for questions and answers. We'll be starting off with the first presentation that Dr. Sasha did, where she talked about aging, and we looked a lot at menopause. Now I have the questions here in my phone, so let me just scroll up. So question 1 was posted from Zoom, and it says, and this is for Dr. Sasha, is it normal for a woman in premenopausal to have palpitations all day? First question.
So even though it is a common symptom, something like palpitations, you have to take seriously. So if I have somebody who presents with palpitations, that's essentially the heart racing. I will investigate fully. I will send you for an ECG. I will actually do a lot more things. So I'm not going to put that off to just being menopause at all. No, I would actually investigate that fully.
Okay, so I'm hoping that the person that asked that question would have heard that answer. Another one for you, Dr. Sasha, is, are there natural herbs to substitute for the commercial vaginal jelly?
I do not know of any, and I would be very cautious with that. You can't just buy a vaginal cream from, no, I will definitely not do that. And similar to the fact that we do not encourage douching. Douching is that habit of washing your vagina with all these lovely brands that have all these lovely smells. No, we do not recommend that at all. It actually changes the natural pH balance of your vagina and changes what we call a normal flora. So there is a question somewhere down the line about clue cells. That's not cancer. Clue cells is exactly how one particular bacteria, something called Gardnerella, looks when you look at it under the microscope. That is a bug that smells really, really bad, right? Yes, you will know as a woman, you know, it smells, you can smell yourself from far away. That happens because of a pH change. So we do not encourage that at all, no. I will, no, I'm sorry.
The next question, I hope the persons who have been asking the questions tonight are taking note of the responses from our experts. The next question is, how often should a pap smear be done? This question is asked very often, very frequently in a lot of different spaces. And so I know it will work tonight.
So in the UK, and there is good reason for this, we actually start pap smears from the age of 25, do it every 3 years up until 50, and then every 5 years up until 65. So they kind of stop then. In the US, and WHO tends to go a little bit more with that, and Trinidad is following that. We start at 21 and do screening every 3 years. Now you would see as the most recent form of pap smears, and I do this as well, is not the conventional, literally take something and wipe on a slide. It's something called liquid-based PrEP, where we can actually do some testing for HPV. Now HPV causes about 99% of all the cancers. If you do that HPV test, and it's recommended above the 30 age group, right? If you do that as well, you can actually not do your pap smears. You can do it every 3 years. It goes, that time frame increases to every 5 years. In the Caribbean so far, and I'm sorry, I shouldn't say the Caribbean, in Trinidad, because I don't know the stance of every other Caribbean island out there. We have not set a cut-off period to stop pap smears. And this is because we are terrible in this country. Every other country, every other first world country, the US, the UK, Australia, etc., their rates of cervical cancer is decreasing. In Trinidad, we have no excuse for it to be increasing at all. And I can tell you, one doctor, one gynecologist, I will see a cervical cancer. Probably I will take a few every month, right? Every month. That's unacceptable, right? Pap smears are a form of screening test. Screening helps to detect cancer before it even reaches that point when you can actually treat it, or at least in the early stages where you can get a better outcome. The pap smear is a classic test because it picks up cancer before it reaches that stage where you don't have to end up, debilitated and on a bed. And I'll give you a very scary something. The last person that I diagnosed with cervical cancer is 31. So please get your pap smears, please. And there is a vaccine. The HPV vaccine is known, there is good evidence to help prevent it. It does not, prevent against every subtype of HPV virus out there, but the majority of it. And again, that's why the first world countries are seeing lower rates of cervical cancer. In Trinidad, the truth is the vaccine is being wasted. It sits in our health centers and nobody goes for it. We should encourage it.
Thank you so much, Doctor. I believe that in Jamaica here, the majority of the population here in Jamaica is very skeptic about the HPV vaccine, as recently, I'm not sure how many persons are aware, but it was this big thing in the schools where they were asking parents to allow children to take the vaccine, and a lot of parents were against.
Right. So that I love this. This is the best forum to actually address that. I know in Trinidad, a lot of I'm trying to find the correct word. I don't want to say fight down because that's a colloquial term. Came from the churches, right? We should not be opting in for vaccines. We should be opting out. So let it be mandatory. And if you have a reason to say opt out, then fine. That's my personal take of it. And it's a take of a lot of doctors out there. It does not encourage your child to become sexually active. And that was the thinking. HPV in the UK and the US are no longer considered we don't just consider it an STD. Right. You can actually get this from touching, right? And there are types of HPV, and the vaccine will protect against those. That will give you the warts. You will see children with warts on their feet and warts on their hand. Why not protect them from that as well? We need to stop thinking that we will be encouraging our children to have sex. This has nothing to do with that whatsoever. It's all about protecting our women.
Absolutely. Well, great response there, great information. Guys, I hope that we will transfer this knowledge to somebody else, and so that we can all be educated and not ignorant, and we can support and be better, become more healthy, or become healthier as we continue to grow. Next question for you, Doctor. I'm just going to ask you about 3 more, and then we're going to move right on over to Dr. Alfonso. Now, this question is from Joe Carriel, saying, after 60, is estrogen replacement recommended?
So that was one of the cautions. It is safe. It is absolutely safe within the first 5 years of your menopause. Benefits are definitely more than the risk. After 60, that's where you have to be a little more cautious. It does not mean it is contraindicated. So we would look at your cholesterol. We would make sure you have your mammograms. We make sure you have your smears, that your blood pressure is fine, etc. We will check up on you, and then it will be an individual decision, right, with the patient in front of you to decide whether or not you want to start or continue after that age. So it's very, very individualized.
Absolutely. This question is not in the list here, but I'm very curious to ask. This one is specifically from me. Now, I'm a survivor of endometriosis. I'm still a warrior, we say endo warriors. And this month is celebrated, or is acknowledged as Endometriosis Awareness Month. Tomorrow will be Endometriosis Day, where we'll be all wearing yellow in support of women who go through this debilitating, excruciating pain kind of condition. No, the word estrogen, after you concluded your presentation, you'd have heard me stress the word estrogen so much, because on my research, I get to realize that the increase of estrogen in my body increases the pain or the inflammation in my pelvic region. Now, I want to ask this, is it okay then because right now I'm on a lifestyle change where I've adjusted my diet, I'm doing the aerobic exercises to release, endorphins and all those other good stuff. But I realized that I've eliminated a lot of food items that produces estrogen. I don't know how or if that's a bad or good thing for me, because I'm trying to eliminate the inflammation in my, pelvic region. Now I want to know, is it okay for me to cut the estrogen? Are there different types of food that I can eat to give me a different type of hormone that would do the same work that estrogen would do? What's your take on that?
Okay, so I'll try. It's a complex question, complex answer, but I'll take it in parts, right? Endometriosis is common. It is not something that is in the mind of anyone. Endometriosis is painful. It is debilitating. It is so common, it can happen in about 9% of the population. That is almost 1 every 10 women. A lot of times women begin to feel these symptoms from adolescence, and they are told by their mothers and their grandmothers that's part of growing up, and they ignore the pain. I'm sorry, please speak out and listen to your children, because after a while, as the years goes by, they lose time in school. They cannot go out because they are always in pain. And then the condition worsens, and then we get you when it's so severe, right? We do, myself and Dr. Brady, who is a reproductive subspecialist, have done a lot of meetings with the Trinidad and Tobago Endometriosis Association. On their website, they have, just because I'm familiar again with Trinidad, on their website, they have a lot of information on changes in lifestyle, the types of exercises and the foods that you can eat, which some persons say help. My take on it is really simple. There is nothing wrong with eating healthy. Even if you don't have endometriosis, there is nothing wrong with that. If it does good for you, please continue, enjoy. That's my take on it. Decreasing the inflammation, I think a lot of persons, I think it's not understanding what we mean by that inflammation. And I get it, it's the media. Endometriosis is that lining of the womb is not blood, it's a tissue type. So endometriosis is where that tissue type is not just within the lining of the womb, it's elsewhere within the pelvis. So it will respond to hormones the same way as the lining of the womb. So it's an inflammatory process, but not necessarily what we mean like inflammation, but I get your point, right? It's an inflammatory process that happens. So you do get scarring and so on within the pelvis. Simple things, right? So your lifestyle modifications, if that tends to work, that's fine. We can actually quiet down this inflammatory process with other hormones if necessary, right? So there are ways, and there is a ladder. There is a step ladder. So we try the easiest things, which do not have a lot of side effects first, and then we move up the ladder. You know, surgery is an option, but not all the time. I don't need surgery to diagnose you. I don't need surgery to start to treat you, right? But if you want to do that, that's fine. There is no harm, honestly, in changing your diet. If you want to cut out meats or so on, it's fine. It's not going to do any harm. It's not going to make the condition worse. If it makes it better, then you get a plus, essentially, right? That's for endometriosis. If I know that may have been my last question from you, but I just quickly want to touch on one or two things, if that's okay. Is that okay? Do I have 2 minutes?
Yes, doctor, you may go ahead.
There were one or two questions. One of them, someone asked if shorter cycles are common around the perimenopause. Yes, that's actually normal. Your cycles can actually last shorter, and you are probably one of the lucky few. There are a lot of persons who get the very irregular ones. So that is normal. That's fine. There was a question about pap smears detecting cancer of the womb. You're just kind of mixing it up a little bit, and I'm not sure who asked the question. So pap smears detect cancer, precancerous lesions from the neck of the womb, which is different from inside the womb and in the lining of the womb. That's a completely different area, completely different cell type. It's very different. So it's two different things, all right? No, vaccines do not sterilize. I'm saying that forthwith. Vaccines do not sterilize anybody. I'm sorry. Again, I don't know who made that comment. No, simply no. I'm not going to have that discussion about that one. And inflammation of the uterus is not the same thing as atrophic changes. So atrophic changes are what we were talking about, but the thinning of the, the skin and the tissues in your vagina and your reproductive organs, etc. That's very, very different from inflammation of the uterus. I will try to answer as many questions as I can. If it's allowed, if y'all could send me direct messages, I will try my best, because I know I will take up a lot of time.
Thank you so much, Dr. Sasha. I am just here scrolling through the questions on my phone, and they are absolutely a lot. There are many. I'm not sure, but probably IADPA will have to do something continuous after today so that we can facilitate the question and the learning process of health. But we are going to move right on over to Dr. Alfonso with his questions. All right, so I'm seeing here Dr. Alfonso. A lot of questions. All right. All right, let's come right on up. Dr. Alfonso. No, at the beginning, Dr. Alfonso, when you mentioned something while I look for these questions, you mentioned that sometimes it's our mind that, enhances. I'm not sure if that's what you were saying, but I think that's what I got, that enhances the pain. And somebody made a reference or a comment in the chat to say, are you saying that periods aren't painful? Are you saying that we are thinking ourselves into the pain? Just before you comment on that, I remember after doing my surgery last year and I went back to the doctor, he said, Sasha Lynn, you're not going to feel any pain. And I'm like, but doctor, I am feeling the pain. And he's like, no, you did surgery less than 6 months ago. You should not be feeling any pain. But in truth and in fact, I was feeling excruciating pain. And he kept trying to convince me that it was my mind. No, can you clear up the concerns about us thinking ourselves into pain or out of pain, and us thinking that periods aren't painful, quote unquote, based on the comment that was made in the chat?
Now, notice I said that painful periods are real. It's a real thing. Sure, I'm getting no feedback. It's a real thing. One moment, please. Sure, I'm getting no feedback. Now, notice I said that period pain are real. It's a real thing. There's some women who have more painful periods than others. But just that in every other condition, one moment, please. Shay, I'm getting no feedback. Now, notice I said that just like any other painful condition, whether it be musculoskeletal pain, your period pain, headaches, stomach ache, yes, there might be an organic cause. That is, there's a physical cause that make you have pain. However, the amount of pain that you feel from that organic cause often depends to some extent on how you think, what is your attitude towards pain. And I just want to say, not to say that some women don't have a lot of pain during the period or difficult periods, because they do, and this is real. But quite often, in the early stages of a girl having her period, the attitude around her, it could be from mothers, it could be from aunties, it could be from whomever around her, sometimes can psychogenically or psychologically induce more pain than she naturally would have. Or she's not learning how to deal with the pain or deal with a normal period. And as a result, you might find some women go through every month some very painful period, needlessly in a sense, because of the way they were trained or what they were told about a period. The same way you can have pain some other part of your body, that psychogenically it can be induced by the attitude of the persons around you and their own attitude to the pain or to their period. So that's the point I'm making. Not that period is not real, period pain is not real, because it is. I'm sure the good doctor can tell you they are. But just that in any pain issue, our psyche about the pain can cause us to feel more pain or less pain.
I understand, doctor. So in essence, our psyche can also affect the physical. Like we did say earlier, that health is indeed absolutely holistic. Dr. Alfonso, I finally found your questions from the myriad that's in my phone. The first one is, well, I just asked the first one. Now, I see a lot more questions for Dr. Sasha as opposed to Dr. Alfonso. But let's see. Guys, we didn't have any question for Dr. Alfonso, but yes, here's one. Can menopausal women stop anxiety? I'm not sure exactly what that is asking, but it says, can menopausal women stop anxiety?
I see maybe someone asking about the different things you can use to treat menopause, anxiety during menopause. Right. I saw somebody mention Rivotril, Coreg, and Ashwagandha. Just to explain a little bit, Rivotril is what we call, in medical term, clonazepam, or one of the underlying medical term for this, clonazepam. It's a medication that is on the group of what we call benzodiazepines. They're often used to treat anxiety. So I'm sure you heard of Valium, you heard of lorazepam, diazepam, the same family of drugs. Now, they can treat anxiety, whether it be before menopause, during menopause, after menopause. However, they can also be addictive. So I don't normally just prescribe a medication off the bat for someone having an issue with anxiety. We look for different ways in which we can treat anxiety. Again, the cognitive behavioral therapy, exercising, even diet, even group sessions. One of the things I used to do with my patients we used to have like group sessions of people who have anxiety, and we'll have like maybe 6 people in a room, and I would do something like a guided meditation. Now, I know sometimes us as Christians sometimes don't love to hear the term like guided meditation, but this is not conjuring up no spirits or praying to no false god or into a devil or anything like that. It's getting you in a mindset, usually through breathing exercises, you know, to naturally heal whatever ailment you have, whether it be physical or mental. And so I've seen the effectiveness of that. Even something like acupuncture as well. I've used acupuncture in a group setting with guided meditation, with music therapy, with aromatherapy as well. And what I find in that setting, a lot of people, for example, people with insomnia who find it difficult to sleep. When I worked at Crossroads Center in Antigua, one of the things that we did was acupuncture breathing sessions to help patients with insomnia so they don't have to go back to the drugs they were taking so they could sleep, which were often addictive. And I found that it worked. Someone asked about Coreg. Coreg is an antihypertensive medication. It has the effect of slowing down the heart to some extent. So maybe if a patient has, you know, fast heartbeat or irregular heartbeat during menopause, which can occur, maybe the Coreg will help with that. But from the point of view of the anxiety, again, I don't necessarily use that off the bat just to treat anxiety. Ashwagandha is a natural plant-based herbal medicine. I think they use a lot in India. There's some studies that shows that it's beneficial to treat anxiety. Some studies say it's not. I've spoken to a lot of, you know, Indian patients or Indian people who have met here in Antigua, some at the university where I work. And, you know, the feedback I get that ashwagandha does work for some people, it doesn't work for others. And that's the truth of almost any medication, whether they're conventional medication or traditional medication, you'll find they work for some people and they work for others. So what I normally recommend though, any issue that you're dealing with, especially when it comes to mental health, just don't think about medication off the bat as the first line of treatment. Think again, if the person is cognitive enough, how can we change the thinking? How can we change the decisions? How can we change our actions so we can have a better outcome?
Okay, so I'm seeing, thank you so much, Dr. Alfonso. I'll ask you one more question as it relates to the mental space, and then I'll see if we have enough time to throw about 2 more questions over to Dr. Sasha, as I see them coming in the chat very rapidly. Dr. Alfonso, if an introvert is depressed, and because I listed a few of the actions that you say people can take to get out of that depression. But if the person who is depressed is introverted, what are the different or customized approaches that we can take to help them get out of that depression?
Very good question. And if a person is introverted and they're depressed, that's a difficult situation because when a person becomes depressed, they tend to be a bit more introverted than they normally are. So again, you have to deal with it at the individual level in terms of getting that person to talk, getting somebody who trusts them. And they're skilled counselors who are very skilled in getting patients to express themselves. One of the things I do, and one of the things I find that helps, is getting people in group setting. Because even a person is very introverted, when you get them in a group setting and they realize that other people are going through the things that they're going through, other people might be introverted as well in that same group, they tend now to be able to express themselves a little better. So the first and foremost thing is to get that person to talk, to express themselves. So you can know what the level of depression they have, as opposed to the fact that they're just introverted as well. Once you have made a distinction in terms of what is depression or what is just that the person is shy or introverted, and I tend to use the word shy because people can kind of associate themselves with that a bit easier. So when we know what is shyness and what is depression and how the two, you know, makes of a mix in that patient's condition, then we're better able to treat that issue a bit better. Just quickly, I want to say, I saw someone ask a question, if you could explain CBT a little more. And just to kind of explain CBT, this is not the book definition, but just that for layman's term. From the time we're born, we think a certain way. If you're Seventh-day Adventist, you think different from, let's say, a Catholic. if you're Black, you might think different from a white person based on where you're from or your family background, not necessarily because of the race per se. If you're Russian, you're probably going to think differently from someone from United States. Again, it's all about your training, how you grew up, your society, your community. And all these sometimes create certain issues in our mind. What is truth? What is false? What causes pain? What does not cause pain? What makes me sick? What does not make me sick? What makes me depressed? What does not make me depressed? So what CBT aims to do, and it's usually done by counselors who are trained in this modality of mental health treatment, is that it helps, what I was mentioning earlier, to help you to change your thinking, okay? For example, sometimes we have patients with pain issues, chronic pain issues, and they will tell me, Dr. Simon, the reason why I take opioids, these are things like heroin, morphine, oxycodone, OxyContin, medication like those, is because I have pain. But I say to them, what are you aiming to do? Are you aiming to be pain-free, or you're aiming to deal with the pain? Most patients say, I'm aiming to be pain-free. But then you find quite often, to be pain-free, you have to take a medication that not only takes away your pain, but it takes away your sense of cognition. It takes away sometimes what makes you you. It makes you zombie-like sometimes. So I say to them, how much of pain can you bear in a day? What level of pain can you bear in a day? And maybe you might want to get to that pain level that is more or less comfortable, and let's aim for that in terms of the medication. And the rest of it now, let's find some other way to deal with it. Let's find a support group. Let's find the mindfulness. Let's find the meditation factor, the music, the dancing, maybe the beach outing, other things that can help you to decrease pain. And when you do that, you find that patients respond more positively than just a medication. So in a nutshell, CBT again is a way of changing our thinking, changing our decisions, changing our actions to produce a better outcome.
Absolutely potent. Thank you so much, Doctor. Unfortunately, we are out of time for the questions, but as you heard earlier, Dr. Sasha is willing to take some questions if our superiors would be able to facilitate that through another medium. So at this point in time, as we told you earlier, we have the prizes giveaway or the prizes section, and we are here. But before we go there, let me just make special mention of our sales director who is also, or the VP of sales who is also joining us this evening, Anita Rodriguez, and sales and marketing. Thank you so much for joining and welcome this evening as well. Thank you so much, Dr. Sasha and Dr. Alfonso. Very informative and timely information, something that we need in our everyday life to know so that we can have a better life, a healthier life, and better health in total. And so now I will just make a few mention. Well, before I make the mention, let me just ask 2 questions to get 2 winners, because our managers, while the presentation was going on, was randomly selecting people from different countries to participate and be a part of our prizes and giveaways. But I'll ask a question or 2. You'll raise your hand, and the first correct answer will also win a prize. They are on the chat and they are listening and looking for the first correct answer, or you can send the first correct answer in the chat. I think that's a better way. Now, first question. What is the layman term for vasomotor? So vasomotor symptoms, which Dr. Sasha spoke about that. What is the layman term for vasomotor? I'll give you a clue.
Nerve muscle.
Oh, all right, there we have it. I see some answers coming in. Our winner, I would think, is Faye David. She said, or he said, hot flashes. Please type the country that you are in as the managers are taking note of the winners. Next question. What is the layman term for, or let me change that. What is the scientific word for bone loss? What's the scientific word for bone loss? All right, we have some winners coming in the chat. I'm sure the managers are taking note. Please also state the country that you are from. And finally, one last question, and this is from Dr. Alfonso's section. What name at least 3 things that you can do to reduce depression? Name at least 3 things that you can do to reduce depression. Please name them once in one message, please. One message. All right, so I see the chat's moving so fast. I'm sure the managers are taking notes of our online winners, and so they will inform you once you've stated where you are from. You can send a message in the chat directly to either Wendy or Esther. State where you are from, and they'll tell you what your prize is. Remember, we have 2 prizes. You will be getting a consultation with an expert as, as valid as the ones we've had here tonight and as credible as the ones we've had here this evening. Or you will be getting a copy of the book that Dr. Alfonso mentioned and that we've been talking about all night, Feeling Good, because we must feel good. We must be healthy to feel good. But we move on now to, I'll just call the names of some winners here. If you hear your name, it means that you are a winner. In order to retrieve your prizes, we're asking you to visit the nearest bookstore in your country. It is the IADPA bookstore in your country, the nearest IADPA branch bookstore in your country. Winners from Antigua, we have Khaleesi, Baltimore, Thaibu, please pardon me if I'm butchering the names, Junon, Christina, Nafisa, Damir. Montserrat, we have Y, Hariden. Antigua, again, we have Khaleesi. Okay, we call that one already. So we have Tobago now. We have Sharon, Job, Edwards. You've won a consultation. Kathleen Fletcher, you've won a book. Grenada, Oslin Thompson, you've won a consultation. Marilyn Lewis, you've won a book. Winners from the North Conference, you've won a Sherilyn Carey Alexander, you've won a consultation. Winners from St. Croix, we have Judy Herbert. And from St. Thomas, you've won a consultation. And from St. Thomas, you've won Feeling Good. Sherry Cathy from St. Martin, that you've won a Feeling Good book. Guyana, Kelita Roberts, and we have Denise Light. Suriname, you have Heidi Blackman and Gilma Daniel. Guyana, again, we have Kelita Roberts and Denise, well, we just mentioned that, Denise Light. Right, and so we'll be receiving some more from some more Caribbean countries, but I'm sure the managers will be messaging you if you are on Zoom to inform you of your prizes that you have won. Well, this brings us to the end of the session, the seminar for tonight. I mean, we could go on and on asking these questions, educating ourselves, but we are strapped for time. And so we take this opportunity to thank each and every one who took the time out to join us this evening, whether you joined on Zoom, almost 800 persons, and if you joined on YouTube, over 200, we thank you so much for participating. Remember that health is wealth. And remember, ladies, you cannot pour from an empty cup. So take the time to take some time for yourself. And I leave this final quote with you. If your body is not right, the rest of your day will go wrong. Take care of yourself. There we have it. I am your host. I've been your host, Sasha Hay, from right here, straight out of Jamaica. Good night, everyone. We turn over to Desiree Doyle as she does the honors in giving the vote of thanks.
Thank you very much, Sasha. I'm fanning not because I'm having hot flashes, but because this session was just hot, hot, hot. And it is because of all of the participants that did a great job. I'm trying to go very fast because I don't want to keep you any longer. I want to say thank you to our administrators from IADPA, our president, Saul Otis, our bookstore director, Clara Springler, and our customer service director, Anita Rodriguez. And we also want to say special thank you to our two facilitators, Dr. Simon and Dr. Lyons. You did a marvelous job. Thank you so very much. I want to make a special thank you and for the support of our women's ministry directors and our health ministries director from across the Caribbean Union of Seventh-day Adventists. Thank you very much. I know some of you are with us. We don't have the time to mention you by name, but we want to register that we are very, very thankful for your continued support to the ministry of our publication. Also, I want to say thanks to Sasha for hosting. You did a very good job in our hosting of our program today. May God continue to bless you in your ministry. To all our participants, all our invited guests, thank you so much for logging on. Thank you so much for participating. And I want to remind you not to forget that this evening's program was just a tip of the iceberg in terms of information. So you need to buy the book at your nearest IADPA store. You need to acquire a copy of the book so that we can live a better life feeling good. Thank you so much to everyone. I hope I'm not forgetting anybody. Thank you so much and have a good evening. Am I forgetting anybody? Any of the directors? No. So let us bow our heads for a quick prayer of closing.
Quickly, Desiree, before you pray, quickly, we have a link in the chat that we would want you to go in and do the evaluation for us, please. We want to get the program evaluated and know what you have to say about it. So please go into the chat and do the evaluation. Thank you. Over to you, Desiree.
Oh, and before I go, I want to say thank you to all the managers across the Caribbean Union for putting this program together. Let us pray. Father in heaven, we give you thanks for your goodness and your mercies towards us. We thank you so much for this program that we've had tonight. We ask an extra special blessing on all of our women who are present here today. Tonight, we ask you, dear Lord, that you'll give them a special unction so that they can live a fruitful, they can live a life of feeling good and a better life, dear Lord. Continue to bless and continue to go before us and help us to follow your leading in Jesus' name, amen. Good evening, everybody. And thank you again.
Bye, everyone. Remember to stay healthy.
Are we still on?
Yes, you are.
Okay. Don't forget to get the book. Collect your prizes at your store. Yes.